Yeah, no, I was involved in the first session this morning, which was a panel discussion with Janet Morrison from Independent Age and Lorraine Jackson from the Department of Health and Gregor Henderson from Public Health England, and we were focused on how far loneliness has come up the political agenda in the last few years, which it really has. There are lots of good initiatives coming from government at the moment to help promote action to tackle loneliness. There's a measurement, an indicator to track how far local authorities are, how many people in their local area are feeling lonely, which can provide them with information to take local action. But we also talked about the challenges in tackling loneliness. First and foremost is funding. Local government budgets in particular are under pressure, and they're finding it hard to do more than fulfil their statutory obligations and to fund support in the voluntary sector to sort of tackle isolation and loneliness. So that's a big challenge. We also need to remember that loneliness doesn't just affect older people, but disabled people as well, particularly those with learning disabilities. We need to be aware that that's a priority too. And there's lots of change going on in the health and social care system, which could be a positive thing, but also is providing a challenge to people in terms of getting new systems up and running. Local governments now are responsible for public health, and we've got new health and wellbeing boards up and running, which is supposed to look across the whole system of social care and health to make best use of resources. And they need to be making loneliness a priority, but they've got lots of other priorities to meet as well. So lots of challenges, but lots of positives as well. Yes, no, I think this is a particularly important day because we've gathered together people who are taking action on the ground to tackle loneliness, which could be very small voluntary agencies for whom they're very focused on doing things, and they perhaps don't really have a lot of time to be able to share their insights with national leaders and policymakers. So this provides a really great opportunity for them to do that and share their learning and hopefully influence people who make decisions about where funding goes and where sort of policy goes on this front.
So today I've been at the Campaign to End Loneliness Connect and Act conference, which is talking about how we can actually make strides against tackling loneliness and isolation in our communities. I'm from the Department of Health, and I was part of a panel discussion where we were talking about what role can the department play in actually pushing this agenda forward. I was talking about how the department is now a steward for the whole health and care system, and that we're responsible for making sure that every part of that system acts in a way that's preventative, that actually takes people with them in terms of understanding what people can do themselves and in their communities to tackle this issue. We had some interesting questions from the panel around how, in an environment that's very challenging financially for councils, we can actually make this something which isn't competing with what they see as their main business of meeting critical and substantial needs for social care. And we had a very good discussion between ourselves and Public Health England about how we can actually provide some really good tools so that local areas can unlock the potential that exists in their own communities to tackle this issue. Because councils can't do this alone, government can't do this alone. This is about individuals, society, families and communities coming together to actually do some low-level, at times, interventions, but those that work to actually tackle loneliness. We also talked quite a lot about the role of evidence and measurement and making sure that people actually understand what works so that they can make some very tough decisions about investing in the things that they're going to make the best result on people's outcomes. Because this is about well-being and a long-term thinking about this rather than short-term decisions related just to funding.
Wow, okay. What do you think this conference is gathering?
I think it's really important because this is shining a light on the whole issue of loneliness, which is going up the agenda. So the campaign to end loneliness has been really important in actually making sure that people understand that this is an issue which harms people's health. It's actually a very personal issue to people, and sometimes it's got some stigma around it which people find very difficult to talk about. So the campaign's giving us all permission to talk about it, and importantly they're giving us permission to talk about what we can do about it. So I think this is going to be, this is the start. The campaign's relatively new. This is the start of quite a long-term campaign to actually sort of change people's mindsets in this country about this being something we can actually do something about.